Hi everyone. Hello again. Second time this week, but we're lucky to have great speakers join. And today we have Dr. Costa, Consultant Paediatrician in Allergy. And we will be chatting about wheat allergy. Now, a lot of you have sent through your questions, so we will be going through that today. Now, I am a little bit early, 2 minutes early, so I know that Dr. Costa will be joining us in a moment. In the meantime, you're more than welcome. I see we have a few people online. You are more than welcome to send through your questions. I always like to log on just 2 minutes before to make sure it's all working. I don't know how to be late, actually. That's a problem of mine. But so I think we have Dr. Costa online. So we'll just wait for him to join. And the reason why we decided to focus on wheat allergy this week, or gluten, celiac, just anything about these conditions, is because they sort of intertwined in some way or the other. So here we are. Dr. Costa is and I have my laptop open because I have all the questions on here. I'm so sorry. I'm very early. But I thought, oh, let me log on 2 minutes before
Everything
to
is
make
perfect.
sure it's all working properly, you know?
Always
Wonderful.
tea
You
is
even have a cup
my
of coffee.
lemon and
Tea?
ginger.
Tea, coffee? Oh, lovely. Lovely. I have my Roy boys on the floor, but I
Mine
think
is
it's cold
lukewarm.
now,
I
so
never
don't
like
forget
it too
about that
warm
one.
and cold now. It's unsatisfying. Yeah. You're welcome.
Well, again, thank you for your time, Dr. Costa. This conversation, I've had lots of questions sent through. I don't know if you've had any in your on your Instagram page, but this is a very much a requested video. So, you know, when it comes to wheat allergy, I don't think it's spoken about enough. You know, we talk a lot
Nut
about cow
allergy,
protein
peanut
allergy and
allergy,
soy allergy and egg allergy, but less focused on wheat allergy. Peanut allergy. Oh gosh, yeah, peanut allergies.
which is very
But
important.
let's give the humble wheat some attention, and which is extremely important. So, wheat allergy. I mean, I will save the questions for a bit later. And for anyone who's joined us, you please put your questions in the chat box, and
I'll try.
Dr. Costa will be answering all of them. So, wheat allergy, is it an intolerance or is it an
Okay, so
allergy? I mean, how
wheat
can we
can
just
cause three
clarify
different types of
what it
things.
is first?
Can cause the first one, a wheat allergy, an IgE wheat allergy, can cause a non-IgE wheat allergy, can cause celiac disease, uh, cannot be tolerated by people with celiac disease, does not cause it, and also can cause something called non-celiac gluten sensitivity or intolerance. The names are intertwined. So in reality, it can cause 4 different things. It is. And for people
And
to
that's why
understand
it can be
a
very
little bit better,
confusing, can't it?
so let's, I like to go into basics, because if you don't go into basics, you don't understand the rest. So, foods in general, with 1 or 2 exceptions, have many, many proteins, and are proteins that cause allergy. In wheat, for 1 small grain of wheat, people have no idea of how many proteins have already been identified on that small grain of wheat. Over 300. And from that 300, there has been at least 19 that have been identified as potential allergens or allergens, and they've been characterized. So theoretically, people can be when it comes to a wheat allergy, and that's why I keep on banging on component resolved diagnostics, people can be allergic to one or any number from 1 to 19. And in all those, there's a particular one that I think that we will address in the meanwhile, is one called gliadin. And gliadin, in conjunction with another protein, it makes gluten. So in reality, gluten itself, in the true assumption of the word, exists only in wheat. But then there's all other sorts of cereal that will have a protein that is very similar to gliadin, and therefore we also call it gluten. And this is because, and this is the part that is also interesting for people to understand, is when we do tests for celiac disease, we request a specific test called anti-gliadin antibodies. The name comes from that. See the connection. Anyway, this is the basics. Let's go for the rest.
Wonderful. So I know that I've seen some people join who've inboxed me, and they have children with wheat allergy. So you say, you know, let's talk more in detail exactly about perhaps the IgE and the non-IgE. What are the different symptoms?
The basic rule
for both
of IgE and non-IgE allergies are the type of symptoms and the delay between the ingestion and the symptoms. IgE tends to be the immediate symptoms. People eat it, and either immediately or within a few minutes, they will have either tingling sensations, lip swelling, hives, redness, sometimes swelling of the face, and that then progresses downwards. As I always tell my patients, or the parents of my patients, food-wise, an allergy starts at the point of contact. You eat it, it starts there. Doesn't start at the distance, there. Okay? So, up to 2 hours, we expect to be an IgE allergy. But I tend to say that between 1 and 2 hours is that gray area that I also like to investigate. More than 2 hours, then it would be a non-IgE allergy, up to 72 hours, if people has the normal gastric transit, and therefore, because anything that we eat takes about 72 hours in our system until it goes away. So, anything that is beyond those 2 hours can lead to a non-IgE allergy. And a non-IgE allergy, which there's a few other foods that we often talk about that can lead to non-IgE allergies, will normally lead to eczema or flare-up of eczema, because very, very important, and I keep on saying this, and I said this several times today in my clinic, food does not cause eczema. Important to know, food does not cause eczema. Food can trigger eczema or make it worse. Anyway, so when people eat something like wheat and they have a non-IgE allergy, can lead to an exacerbation of eczema, can lead to reflux, can lead mainly to gastric disturbances, bloating, diarrhea, or constipation. Those are the non-IgE type of signs. Okay? Those ones.
And which ones do you see more of?
Do
you see more IgE or non-IgE? Or to wheat?
More IgE than non-IgE. Interestingly, today I saw 2 non-IgEs. Right.
Yeah.
Just to contradict me.
Okay. Yeah. So the ones that are called or labeled as non-IgE, if someone says, I have
first
a
of all, I'll try to
intolerance,
find out what are the
would you
symptoms.
say to them?
Okay. If the symptoms are simply gastric, and if the symptoms are mainly of diarrhea and bloating, I'm probably going to call that an NCGI or NCGS. But I would investigate for celiac disease, just in case it is celiac disease. Okay? If there's any of the other symptoms that I told you about, mainly with eczema or itching or whatever, then if it is a delayed reaction, so several hours after the ingestion, then I would call that a non-IgE. If it is in a short period of time, I'll do skin prick test right away to find out if it is an IgE-mediated reaction. To make matters a little bit more confusing, are some patients that can have a mixed IgE and non-IgE reaction. Most often I find that one with the dairy products, not so often with wheat, but I do still find it.
Okay. So I just want to pull out one question here because I think it sort of ties into a question I have.
Okay.
So let me just find it here. So it's from a mom. I'm not sure, and I think she's online. So please feel free to comment. In terms of, I'm not sure if it's IgE or non-IgE, but I think it's IgE because she asks, she would like to know if you know any children who have become less sensitive to wheat as they grow up, and whether immunotherapy works with wheat.
Yes, I know quite a lot of children that as they grow up, they will become more allergic to wheat. Actually, wheat is one of the allergies that we normally name it to toddlers or put it on toddlers. Most of the toddlers will outgrow a wheat allergy. Not a lot of people will continue to have a wheat allergy throughout their life until they get to being adults. Now, immunotherapy. The immunotherapy for wheat will be oral immunotherapy, so tailored immunotherapy, and that can be done as a part of a planned ladder, a wheat ladder that can be introduced. But and that has to do with, again, like any other oral immunotherapy, with one, the degradation of the protein, and two, the amount that we give to see if we can slightly increase it either every week, every 2 weeks, to see if they can tolerate it and eventually outgrow their allergies. So, possible? Yes, it is possible.
Okay, thank you so much. I can see a question has come through. Oh, okay, a few more questions. Is the severity of IgE-mediated wheat therapy related to chance of growing out of allergy with time?
I've seen both ways. I've seen children having quite severe allergic reactions, and when I do a complete wheat exclusion, 1 year later, they've gone. And I've seen children with minimal wheat allergies, and 1 year later, it's becoming worse. So it is not possible for me to predict. And the wheel size, and people keep on banging on that one, the wheel size does not give me a prediction of either the potentially of outgrowing an allergy, but also the potential for severe allergic reactions. Because one of the things when it comes to IgE reactions is a lot of factors influence it. The main two factors are dose and concentration, which are fairly obvious. But then there's a few others that have been thoroughly investigated, and mainly for peanut, which is simple things like not having slept well. That decreases the threshold of an allergic reaction, so makes the reaction worse. Doing physical exercise before having the food. Having a cold, having an infection, viral, bacterial, whatever it is, that will also decrease the threshold, therefore increasing the potential allergic reaction. So as you see, just in this, I've already spoken about 5 factors that will affect an allergic reaction. So it is not straightforward.
Yeah. Okay. Thank you for that. I hope that answers your questions. Feel free to add anything else if you have anything else to add. And then we have another question here. Does wheat pass through breast milk?
It does.
Previously advised it didn't, so
it does pass through breast milk. And
yeah.
If someone, a mother, has a wheat product, and just 1 dose of wheat, we can test wheat on the breast milk 4 days later still. And then it disappears. Actually, I made a post, and afterwards, if I remember, I'll put. I made a post about the allergens in breast milk, and I explained that there. So, yeah.
Yes, I remember peanuts, that post.
Cow's milk, wheat, and egg, if I'm not mistaken.
Okay, okay, wonderful. So I'm not sure what your name is, but in short, yes, it can
The
pass through
thing
breast
is,
milk.
we
It's a bit
we
like all the other
accept all
allergens.
allergens are
So
expressed on the breast milk, all of them. Now, the problem is there's not been research done into all of them because I think that there's no point really. Uh, you know, if sometimes people can think that the breast milk will have a particular smell or taste because of what mother is eating, of course that allergens will be expressed there. They're going on circulation, the allergen is there, and as the allergen is there, it's going to be expressed. So I don't think that there would be anything that would not come on breast milk. Everything would do.
yeah, but the dose
Yeah,
obviously is hard to know. The quantity that's passed through,
normally I
that's
say it is
hard
highly
to determine,
diluted.
isn't
It can come on a factor of 10,000 to 1 or 1,000 to 1. So it's not a one-to-one expression. It's never a one-to-one expression. And that is why the
it? Yeah.
reason why sometimes babies will have a reaction to whatever mother is eating is because, you know, they eat quite a lot. It's like I have mothers that they eat so much cheese in one day that of course there's going to be loads of cow's milk protein there. Or others, they love bread and they eat a lot of bread. So, you know, it's very much depending on maternal diet.
And in terms of, let's say that baby is now 8 months or 6 months, and they're thinking,
Okay?
okay, the baby has non-IgE, yeah, and it's time to challenge them on wheat. And this is a question now for you. Do
I
we
will
do
do it
it through
directly to
breast
baby.
milk or do we do it directly to baby?
Because of the same thing, you know, unless if I give mother a
Yeah,
massive loaf of bread, so the baby is going
yeah,
to get exposed to a nice amount of protein, then probably are not going to have any results. Yeah.
yeah. And it's the same for cow's milk protein allergy, isn't it? We see a lot of parents who do it through breast milk first,
Not
challenge through breast milk. And that's
not just
because they're
because they're
worried, which is
worried. A
understandable,
lot of
but you
them
don't get a
have been
true picture.
advised to do it that way, which is wrong.
Okay,
No,
okay. Right.
no,
Yeah,
no.
yeah. So we don't do that.
Different ballpark.
Directly to baby for non-IgE. For IgE, so yeah, for conversation. Okay, so I have another question for you, Dr. Costa. So this one says, my child is 11 months and has allergy to soya, cow's milk, and egg and wheat. Where do I start? Now, I don't know if that's IG or
So,
non-IgE.
uh,
I expect that might be
the way that I
non-IgE,
look
but
at
who
it is
knows?
practicalities. Which one of all of those are the one most used at home, or that you find more often outside when you go and do your shopping? So each person is going to be slightly different. If it is a family that barely has eggs, is once in a while, don't put eggs first. Milk will be in so many products. You know, anything that you buy in a supermarket, probably going to have something there, dairy, casein, whey, you name
Yeah,
it. So probably milk would be one of the best things to do. But to
yeah.
be things to look at things in reality, probably I would start with soya, because it's more often children who tolerate soya first instead of milk, and at least by starting with soya, that they tend to outgrow faster than milk. By starting with soya, will open a massive variability of foods that you
Mm-hmm.
can buy, and that normalizes the life of the family in general. So, one of the things that has
Yeah,
been
right. Okay, that makes
seen so
sense.
far is that the time that people that have children with allergies spend on a supermarket reading ingredients. So that way, they will start focusing on their soya and eating just soya, would decrease the amount of time in the supermarket, will increase quality of life. Yeah,
Okay, that
you
makes
know,
sense, isn't it? It's
there's
thinking
no right
practically
or
about
wrong
what
about where we need
suits
to
the
start.
family.
It needs to be a discussion between us healthcare professionals and the family, and see what suits you best. And depending on that, then we agree on the plan, and again, according to that, we can start to say, look, let's introduce this first, because it's also about which one will we manage to introduce faster, and the ones that we manage to introduce faster, brilliant. You already start to normalize that. Now, the ones that you need to take quite a long time to introduce, leave it for last. So it's all a matter of practicalities.
Yeah, makes sense. And would you, because I remember working with a mom and she eliminated oats as well. What's your take on that? If someone is suspected to have an allergy to wheat, non-IgE, and then they cut out
in reality, let's go back to celiac disease. Do you know that studies say that the amount of gluten in oat is so minimal that it should not affect people with celiac disease? Nevertheless, we still keep on advising to go on an oat, on a gluten-free oat. Okay, so relationship between oat and wheat, just on that very, very small amount of gluten that can be there. Apart from that, there's no reason for someone that has a wheat allergy to exclude oat. Actually, let me just see one thing, because wheat, actually, it's most of the things, I have a big list of things there. Most of the things that people need to avoid when it comes to wheat is processed food that contains wheat, or the several variations of wheat. Because one of the things is, what we call wheat is, has to do, the name of those cereal has to do with the genetic composition of the cereal itself. And the wheat that we use nowadays is what is called an hexagonal form. The chromosome is hexagonal. But you have other ones that are not hexagonal. Okay? So what does that mean? That you're going to find other forms of wheat that have less chromosomes, but still will cross-react with wheat. And that is why you have durum wheat and buckwheat, so on and so forth. There's loads of them. The list is actually quite big. So those ones that are from the same family of wheat, those ones should be avoided. The ones that are not from the wheat family, no point. Keep on eating them.
And someone who has an allergy to wheat, do they also have an allergy to gluten?
Potentially not. Because the most common allergen in a wheat allergy actually is not gliadin. Okay? It's one of the many others. For you to have an idea, not because I know everything from my heart, there's a beautiful book that I use, and this has everything there. And when you go there to the end, there's one page that is just dedicated to wheat, and the amount of things that they say there, the amount of proteins, and that's why, you know, that's where I found out a long time ago that there's more than 300, but only 19 have been identified. They speak about the ones that are most common. The other ones are very, very uncommon. And that is why, again, we do component diagnostics to find out which one is it. And, you know, so far, the few, not many, the few that I've done component diagnostics for wheat did not come positive for gluten.
Right. Okay. Thank you. I think there's another question. So let's see. If my daughter doesn't seem to react to may contain traces of wheat, is it okay to ignore may contain despite previous anaphylaxis reactions to wheat?
Avoid. Okay, because that's
avoid.
The problem is how food industry label things. And a while ago I did this massive rant about food industry and how they label it. So theoretically, if something says traces of, a trace should not cause an allergic reaction, because a trace is something that you cannot measure, you cannot quantify. It's so small that you cannot quantify. Therefore, if you cannot quantify it, how will it cause an allergic reaction? But then going to have the combination of words that may contain traces, and then suddenly you don't know, is it a may contain, is it a trace? What is this? And it has to do with the way that they produce foods in a factory. And that is also the reason why, for instance, when it comes to oats, we tend to tell people to avoid oats in gluten when they have gluten problems. Not because of the oats itself, but because the mill where the oat is being milled also is going to be processing rye and wheat and a few others. So there's a massive amount of cross-contamination. So the same thing that it grinds the wheat, they stop that, they throw it inside, they grind the oat. How much wheat is there going to be there that is going to cross-contaminate oat? So that is why sometimes you're going to find all these wordings about the may this, may that. But for someone that especially had an anaphylactic reaction in the past, no, please avoid completely. And doesn't matter, the may contain signifies, and studies done, a massive variability from 8% contamination to over 80% contamination. And you do not know that packet or that chocolate or whatever that you bought, you don't know which one of those is it going to be. You cannot be sure. Avoid.
Oh. Thank you so much. I hope that's helpful for you. Sorry, I don't know what your name is, but please ask any other questions should you have any. So in terms of, you advise parents as well, like what they can substitute for?
often I say, please speak to my dietitian.
Because I've seen your list, and you have lots of. I know you have a wonderful list, though. I've seen your wonderful list. Because going wheat-free has become easier, really, hasn't it, in recent years? Because, you know, things are popular now, like buckwheat flour and quinoa flour, you name it.
I think that unfortunately this goes in what is fashionable to use, and what someone tells you, oh, this is great. It's like we are on the age of the miracle foods, the superfoods, and very often someone names it something as a superfood. It's nothing. It's just a food. What I would say normally, if I tell someone to avoid wheat, there's a couple of things that I tell them that they can replace it with. But if they want to be more specific, well, some of them I tell them, oh, go and speak to Nishti. She knows more than I do when it comes to that.
Yeah. Yeah. Yeah, and there are many wonderful substitutes for wheat-free. You know, it's not just the ordinary stuff you see in supermarkets. I think you can experiment. For example, you know, I posted yesterday lots
something
of
that I need to be
recipes
educated on
using teff flour, because yeah, it's just so wonderful. It's actually a prebiotic as well, because it's an Ethiopian grain. It's an ancient grain, and it's extremely healthy, rich in iron and protein, and
personally,
it takes practice
by
to
taste,
use
that's one of the things that I use a lot, is cornbread. It's absolutely amazing. Yeah.
Okay, yeah.
It is
lovely.
It is delicious, and of course it is safe to eat for someone that has a wheat allergy. Also is safe for someone that has a gluten allergy or a gluten sensitivity or celiac disease.
Yeah. I just wondered, if you have a child that, let's say, comes in with really severe eczema, and they've cut out dairy and they've cut out soya, what would you say? Would you ever think, okay, let's go wheat-free as well, or is that pushing it?
So normally I tend to say that if the eczema started before they started being weaned into solids, and if the child was bottle-fed, not breastfed, the likelihood of being wheat-related is quite small. Now, if it is a child that is bottle fed and mother had a lot, sorry, breastfed, and the mother had a lot of wheat in the diet, or the eczema started after wheat being introduced, then we need to consider that. There's also children in which they already had eczema, so there was a clear milk allergy there, and as they introduced wheat into the child's diet, the eczema became even worse. So then, yeah, excluding all that. Now, blindly excluding things just because, nah, doesn't work. And most often than not, I'm telling parents how to reintroduce things, or mothers how to reintroduce things into her diet or the child's diet, because I find sometimes foods that parents have been advised of removing from the child's diet that have no relationship whatsoever with non-IgE reactions. But why did they say that? Yeah, puzzles me. So again, I need to see on a case-by-case basis. Now, sometimes, and I have some of them, and actually today I saw one. A girl on 12 years old, that they don't remember when things started. So as they don't remember when things started, and they think, oh, I think that probably. So what I say, okay, in that case, let's exclude all of it, and let's find out. Okay. So in that case, and in this case, she was already excluding two things. I said, okay, in that case, try to reduce it again to see if there's an exacerbation of the eczema. If there's no exacerbation of the eczema, and she was excluding that for already 8 months without being advised to reintroduce it, I said, introduce it again, and I gave her a plan about how to introduce it. See if there's a flare-up of the eczema. If there's not, brilliant, you can start with that again, but exclude the other two to see if that makes a difference, along with treatment of the eczema, of course.
Right. Okay, thank you. That's very helpful. There is a question here from AAWJ Nutrition, who says, could I please ask a question on allergy tests, please?
IgG.
What are
I saw
your
that
thoughts
one.
on food IgE
My
antibody
thoughts are
tests?
very bad. No, don't do food IgG. So it's again, let's go a bit back to basics. Ig means immunoglobulin. G is the group of immunoglobulins. So IgG and IgM, very important immunoglobulins in our immune system, as they protect us against foreign invaders. Let's put it this way. What does this do? Let's start with virus and bacteria, because it's the best way to understand this. When someone has a viral infection, IgM jumps, because that is an innate immune response to protect the body against the viral infection. And it gives the immune system some time for them to start producing IgG, which will lead to the production of antibodies. So when we test for past infections, we test for IgG. And if IgG is positive, means that someone has been exposed, they have antibodies, so therefore they have memory cells. Okay? So IgG, basically, memory cells. But it's not just memory cells for viruses and bacteria, are actually memory cells for food. And especially the tests that we're talking about are based on something called IgG4, which tests specific for foods, and tests specific for foods that either you are eating or your body has already eaten and knows that you've been exposed to it. As I tend to say, if I give you a cradle of bananas today, and I'm going to test it for IgG4 for banana tomorrow, it's going to come sky high. So does that mean that you're allergic to that? No, it just simply means that you've been exposed and your immune system reacted. So IgG tests are extremely unreliable. So when someone comes to me with IgG tests, look, I just said, please take it away. Often, and for you to see, or sometimes this is ridiculous, I saw child last week, a 2-year-old child, that the first column of IgG tests saying that the child was allergic to was alcoholic drinks. And I just turned to the parents and said, look, can you not see how ridiculous this is? Because either this is ridiculous, or I have to call social services because you've been giving alcohol to your child. And they just laughed. So this is what happens. And when you're going to see the description of all those IgG tests, and it appears a massive, massive list of things that the child is allergic to, or the adult is allergic to, very often they put names in a very confusing way. They'll put dairy, they'll put cow's milk, they'll put casein, they'll put whey, as you being allergic to all of those, when in reality, it's all the same.
Yeah. Unfortunately, they're so common, aren't they? So I'm curious for the person who asked, you know, I mean, what is it that makes people go for these tests? You know, it's obviously desperation for some help. They want to get some answers.
So the British Society of Allergy and Clinical Immunology has already made a statement regarding IgG testing, because all the research has shown that is a test that should not be done because it's extremely unreliable and it does not show allergies. Allergies are shown by IgE testing, or to make things a little bit more complicated, because there's a few other tests, you can do things like basophil activation tests, completely different things. Okay, so and that probably 1 or 2 labs in the country does it, basophil activation test. So those are extremely specific for allergies. IgG are not. Please don't do it.
That's great. Thank you for that. So Pretty says, so which allergy tests
skin prick tests
for UK do you recommend?
Don't do,
and that's you offer
blood
that
tests.
service.
Blood tests, what is called the specific IgEs, I rarely do them. And especially under 2 years of age, specific IgE blood tests bring a significant number of false positives. So don't do it. Under that age, if you're going to do anything at all, if we are worried, do component resolved diagnostics.
Thank you. Thank you so much. I hope that answers your question, Pretty, and also AAWJ Nutrition. Basically, don't spend your money on the IgG test. And if anyone has any other, oh, here we go. Thank you so much. That was what I thought you would say. I have a client that has done this test with a dietitian. Oh, and she has cut so many foods, which I think has not been helpful. Right.
If it is done by a dietitian, they should know better. Most of the people that I find doing those tests are not dietitians, are nutritionists. I find very good nutritionists as well, but I find some very odd things so far, and I don't know why this is done. But invariably, from the moment that you find simple things like, as I mentioned, allergy to alcoholic beverages on a toddler, a baby, you need to question straight away the validity of that. You know, how can someone be allergic? Look, one of them was so specific, some people probably don't know what it is. Vermouth. Vermouth is an Italian drink. Basically, martini is a vermouth. So I had a child that came to me allergic to vermouth. He was a 5-year-old. And I asked Mom, okay, so have you given that? And she just started laughing. She didn't even know what vermouth was. And I said, look, it says there white wine. Your child is allergic to white wine. Can you tell me how your child can be allergic to white wine? And she was like, oh, actually, that one in front of me, she checked it in the bin.
Laugh, don't we? We have to laugh. Oh dear. Okay, question here from C. Tasta. Please, can I ask what your thoughts are on probiotics? Sorry if this has already been asked. We had that question as well on Monday with
Yeah.
Natalie, from Kids Celiac Dietitian. She's a Kids
Well,
Celiac Dietitian. But
we
I'm
spoke
curious
about
to hear what you
probiotics
think,
before as
Dr.
well.
Costa.
So think about it this way. First of all, probiotics cause no harm. And if we think that the place to stimulate the immune system the best is the gut. So if you find the probiotic that works for you, that stimulates the immune system, by all means, but there's no point in taking probiotics as something that actually you've already been having in foods or in breast milk. Because I saw a lot of people that are trying to have or to give their children probiotics that already exist on breast milk. What's the point? You know, so do they cause any harm? No, they don't. That the evidence says cause no harm. The evidence says that probiotics, the best use for probiotics are associated with a specific type of diarrhea by a bacteria, and when it is diarrhea induced by antibiotics. And that has been proven to have a positive effect. All the other ones, the report comes inconclusive. So, does it work? Does it not work? Well, I'm not, put it this way, I'm not against it.
Mm. Okay, I just want to add to that. I have done a blog where I talk about probiotics. I think I would be curious to hear why you considered probiotics in your child or maybe yourself. First of all, what's the reason? What are the symptoms? What's their diet like? And then trying to manipulate the diet. There's so much you can do to enhance the intake of prebiotics. So, for example, we talked about teff or quinoa. You have all these prebiotics, all your vegetables, but you can really nurture your child's gut through a healthy diet and variety as well. And probiotics I think are great, but sometimes we have to just stop and say, what's the intention of giving my
what the
child
problem
or
is,
for
Nishti?
me
I
to
don't know
go
if
on a
you found
probiotic?
that. Sometimes
What's the
people don't
point?
understand what the difference is between a pre and a probiotic.
Yeah. So prebiotic is basically food that you eat that feed the healthy bacteria in your gut. And probiotics are live bacteria that you consume. You can also get live bacteria in foods such as your kimchi and sauerkraut, but I don't
Kefir,
see any children
kefir,
eat
very
that.
good.
Or your kefir, for example. Kefir is fabulous. So but I think where we need to start is basics, and it's looking at the diet overall. And then if your child is struggling with any gastrointestinal issues, then yes, let's look at probiotics. So she was breastfed for 1 year and recently had antibiotics. That's so I can understand the rationale for
Well,
her
unless
thinking
the child develops significant
probiotics,
diarrhea following
because
the antibiotics, probably is not going to make much of a difference.
Okay, so actually, again, I would focus on variety. Last week we focused a lot on 30 plants a week. If you go back and check those posts, okay, I know for children getting 30 plants a week may be difficult, but the main point is variety. Research shows that the more variety you
I agree.
introduce into your diet, the healthier
And
your gut.
especially, again, Mediterranean diet, loads of vegetables, loads of fruits and
So
vegetables, fresh
I
ones.
think there is another,
Yeah.
and great quality carbohydrates. So there is another question here. I have a 5-week-old showing some symptoms as my firstborn who has a dairy and egg allergy. I have now cut these out
How
of my diet.
old is the
GP
child?
review on Tuesday. Any further advice? Thank you.
Oh, okay.
5 weeks. And her firstborn had dairy and egg allergy, and she started to cut
Okay.
basically dairy and egg out
then
of your diet?
what I would suggest is, first of all, what type of symptoms they are. Because what we need to consider is this manifesting itself as an IgE allergy? And if it is, skin prick test. Do skin prick test in the child. So it would be very important. We can do skin prick test in children as young as that.
And Claire, maybe you want to just comment back.
Yeah.
Then we can get a conversation going. It's always nice to have a bit of ping pong, you know. I'm curious whether your older child had
that would be interesting to know, because then, to know if the older child was IgE or non-IgE symptoms.
Exactly. Yeah, I would be curious to know that as well. So that answers that question. I think we'll just wait for people to answer more questions in. Does we pass through? No, yeah, we've tackled all the questions, Dr. Costa.
Yeah.
Is there anything you want to add whilst we wait?
We focus a bit in wheat allergy, but I think it is important for people also to understand about celiac disease. I see everyone with everything. Bupa health insurance? No, I don't. All the other ones I do.
But you see AXA and all the rest. The other, yeah. And you can visit Dr. Costa's website,
yes.
You know, Children's Allergy.
.com. Yeah.
.com.
But so celiac disease, and it is important to know one thing is that celiac disease used to be a disease that we used to have around, or people used to be diagnosed when they are older, in their 30s or 40s. And as time goes by, or as time went by, we started to decrease that level at which we are diagnosing celiac disease. So I remember that when I started medicine a while ago, not long, of course, we started to find in teenagers, and we find very, very odd why teenagers have it. And more recently, we've been starting to find it in children around 5-6 years of age. So if you have any doubt that it might be celiac disease, so eating anything at all with gluten and having either, and it's not, and bear in mind, it's not just diarrhea. Celiac disease can cause constipation as well. Celiac disease can also cause eczema or exacerbate eczema. So if you are in doubt, ask for celiac screen, which is highly valuable. And eventually, it can just be also a non-celiac gluten intolerance, especially, and bear in mind, non-celiac gluten intolerance just affects the gut, lower bottom, not the upper bottom. So the lower part affects the gut, leading to diarrhea. This is non-celiac gluten intolerance or non-celiac gluten sensitivity. There's still debate what to call it, because some people call it a sensitivity. I've seen last year someone talking about, no, this is an intolerance. I'll take it both.
Wonderful, thank you. So Claire says, thank you. It's severe eczema, green poo, reflux, congestion.
Potentially non-IgE.
The lady with the 5-week-old.
The green poo doesn't bother me. You can find all sorts of colors. Except, as I say, except white and red. Those are disturbing.
Yeah.
And I've never seen blue. Blue? Yeah. I've failed to see one so far.
I hope that answers your question, Claire. Good luck with the GP on Tuesday. Oh, and Claire also says, my first is now 5 with dairy, but fine with dairy, but with egg, he's still failing the baked egg test. Okay, my first, we found out.
Okay,
we found out when he had scrambled egg and went blue. Right. Okay. That is definitely IgE. Yeah. Thank you, Claire. Oh, and she also says, my firstborn went to GP and health visitor several times for a month, and no one indicated it could be an allergy. He suffered for months. Sorry to hear that.
Yes.
That is
I've
very sad,
diagnosed
and unfortunately very
non-IgE
common as well.
allergies on children. Probably the worst one, the child was 10 years old, and mother has been struggling with things for 10 years without anyone listening to her. 10 years old. It happened.
Oh gosh, that is traumatic, isn't it? So okay, let's see here. We have a question here. Sorry, another question. If you have tried the milk ladder and failed at step 1, how long would you wait to
is
try
it IgE again? Is it IgE or non-IgE mediated? If it is non-IgE mediated,
yeah,
you can give it a month. There's no strict rule of thumb. Give it a month, try it again. If it is IgE mediated, I'll probably give it a little bit longer, 3-4 months until I started for IgE mediated. And if the child fails again, the IgE mediated, then I would not only repeat skin prick tests if it is got worse, but again, component result diagnostics to find out which is the protein that the child is allergic to. Because then it can just tell me, look, the likelihood is no. Or, yeah, give it a few more months and let's try it.
She says non-IgE. I also want to just say, did you use a malted milk biscuit? If you did, maybe you want to bake your own. You know, if you look up, there are recipes for step 1 of the milk ladder, and they have a 0.035 gram of milk in. So it's quantified, and it might be a better way.
And the other thing is, if you're also struggling with that, instead of offering one malted milk biscuit, offer a quarter. Start with a quarter and see. Yeah, keep it with 1 quarter if the child tolerates. Keep it 1 quarter for 2 or 3 weeks, and then after that, the child is okay. Go for half, and so it's going to be a more delayed introduction, but in reality, you're going to save time because at least you're going to start introducing instead of stopping and starting and stopping and starting, which is going to take far longer. Just try that one. Really?
Yes. She says that she's baked her own, so that's wonderful to hear. We don't hear that a lot, so that's great. Okay, AAWJ Nutrition says, oh, where is it now? Sad face. Oh, that was up. That was when you said you don't take Bupa. So he says, mine is 11, and now the GP has suggested he may be celiac. He has suffered with constipation for a while, and now he has toilet explosions when he does go, but never has had any skin issues or diarrhea.
You can have constipation with diarrhea. Oh, sorry, constipation with celiac disease. If the child is having gluten, do a celiac test, a celiac screen.
Yeah, and celiac screens are fairly straightforward.
Very straightforward. But bear in mind one thing.
Done sort of
for someone that needs a celiac screen, is not just a celiac screen that they're going to need. Okay, they're going to need a few other tests because celiac disease can affect many other organs, including thyroid. So they need to have thyroid function tests. They will need to have liver function tests. Because of poor absorption connected with celiac, they need to have iron tests because a lot of them, they become anemic. So a full blood count and iron tests need to be done. All of that needs to be done. So it's not just going there, celiac screen, go away. No, there's a few other tests that need to be done at the same time.
Yeah, okay. Thank you so much. Jess says, I'm expecting second child. My 3-year-old has IgE allergy to wheat, barley, egg, and milk. Is there anything I can do now to help avoid my second child developing these allergies too?
But please eat that
all of
when
those,
your other
Jess.
child is not around. just for you not to get that and get an allergic reaction. But yeah, do not avoid any foods in your diet, except of course if you're allergic to anything at all. But if you're not allergic to any of them, eat all of those. It is the best thing that you can do for your child or for the unborn child.
Yeah. I have got a blog on that, Jess. I'll see if I can find you and I'll link a blog to you later on as well. Because there is also the concept of eating a variety of different foods, looking after your gut whilst you're pregnant can also play a role later on. Kirsty says, why do you think food allergies are more common nowadays? My 5-year-old is allergic to dairy and nuts. My firstborn doesn't have any, but I'm pregnant and worried about another child.
First thing is, all those wipes that kill 99 point whatever bacteria and viruses, throw them in the bin. Start with that. Let your child go outside and put all sorts of rubbish in their mouth. Because the biggest problem about allergies nowadays is the environment and the society. We started living in a too much clean society, and we are worried that everything needs to be clean. And as someone, there's an amazing paper written nearly 40 years ago that then it was coined as the hygienic hypothesis, although that person did not name it hygienic hypothesis. It's interesting. It was coined after he wrote it. And he said there that the lack of exposure to bacteria and viruses and parasites and all that from nature in general were decreasing the stimulation of the immune system and therefore leading to further allergic reactions. Interestingly, probably one of the most interesting papers written, that the main point of the research, they failed it completely, was one done in Nigeria, in which they went to find, their hypothesis was children living in a city would have more asthma than the children living in the countryside. So, what actually they went to find out was exactly the opposite. The children living in the countryside had more asthma than the ones living in the city. But they kept on investigating those children, and they found that actually the ones that had less breathing problems had more allergies. So the ones in the city had more allergies than the ones on the countryside. And furthermore, they went to find that the ones on the countryside had parasites in their gut, while the ones living in the city did not have parasites in their gut. So they threw an hypothesis that there was a link between having parasites in the gut and the decreased incidence of allergies. But they didn't understand why. Now we know how it is. And we know that parasites in the gut, along with all the other rubbish that they've eaten that went into their gut along with the parasites, actually stimulates the immune system. And by stimulating the immune system, will lead to further tolerance to all sorts of exposures. And that has to do with something called the anion gap that is closed or open in the large bowel and the small bowel, and now this affects the development of the immune system. Talking about that later on today after we chat, and going on from the question that I put yesterday about what is the relationship between butter and allergy, that actually most people voted saying that yes, there's a relationship between butter and the decrease in allergies. You'll find out that in about 1 hour. Yeah.
Are you posting it later? Okay, wonderful. Yeah. Do you remember when we went to Besaki last year, and I can't remember the speaker, but they talked about the tight junctions in the gut and leaky gut, and you know, all these things that are passing through the epithelial layer that shouldn't be passing through. And you know, when it comes to cleaning, I think it's also important to think about, you know, first of all, how often we clean, but also what we clean with. Because I remember, you know, looking at the research that said there's so many toxins, and since the 1960s, I think we've had 220,000 foreign chemicals introduced into the lives of of, you know, of us, and no wonder allergies
Well, think
have
about it
risen. We literally
this way.
are surrounded by foreign
After the
chemicals
Vietnam War, the FDA, so in the States, the Food and Drug Administration, accepted around 50,000 chemicals to use in foods that were never tested in human beings or animals, nothing. So we really don't know how those 50,000, now as you say, more than 200,000 are there that have never been tested. What is the negative effect? So for me, as often as I can eat organic, I'll eat organic.
Me too, me too. And when it comes to cleaning, make your own products, you know, make your own cleaning products. They put so much rubbish in our cleaning products, or buy, for example, methods or e-cover. Can you tell this is my thing? I love to clean, but I don't want all these foreign particles.
I'm still from the time that my grandmother used lemon-based products made at home to clean. And vinegar to disinfect fruits and vegetables before eating. So you put a few drops of vinegar in the water of fruits and vegetables. My mother used to do that as well. So and it is wonderful. So, and when bleach came, my grandmother was like, it kills too many things. It's not good for the skin. I don't like it. Yeah.
Oh, brilliant. Yes, there's just too many chemicals around. And when we have children with eczema, I always try and offer a holistic approach, you know, because it's not just about the food, it's also about the home environment.
You know, there's
particularly what products we're
a professor in epidemiology. He has retired in University College London, and he made this amazing study. He managed to backtrack what bacteria was living in people's guts more than a century ago. Interesting. And he showed the evolution of bacteria in people's guts in England from more than a century ago until now. And what he said is that not just it decreases the variability of bacteria, but also the concentration of bacteria. Because a lot of the things that we eat will kill the bacteria that is there. And it's not just talking about antibiotics and things for reflux, like what we call PPIs. It's not just that. A lot of things that we eat, the chemicals there will kill the good bacteria that we have in our gut. And he has proven that. So it's interesting that there's so many things that show that gut environment is extremely important, but yet also, you know that when I was probably about 4 or 5 years ago, the FDA issued a report saying that they were forbidding the wipes that kill 99.99% of bacteria in the States because of the effect on allergies. Why haven't they done it here yet? Why hasn't the MHRA done that yet?
Yeah.
Start with that. If you have them, anything at all like that, throw them in the bin.
Right. Yeah, there's so much we can do, isn't there, to make our environment less toxic, because it really does enhance the gut. And remember, everything starts in the gut. All disease starts in the gut. Okay, wonderful. Oh my God, 9 o'clock. Hello. It always happens, isn't it? We can go on and on. So thank you everyone for joining. And if you have any requests that you want Dr. Costa to do more videos on, please let us know, or myself, please let us know, and we will be happy to do it. It's always lovely to help mothers and fathers out there. So thank you so much. Any last questions before we sign off? Thank you so much, Dr. Costa. I know it's very valuable time. So, and maybe you can just talk about where you work, and you also have Allerpack for those with IgE allergies.
It is
Perhaps you could
mainly,
just talk about what that
especially for
is that
children that have
comes from
anaphylaxis and they
yours.
need to carry adrenaline pens. One of the things that is not often spoken about is that adrenaline needs to be kept away from the sun and it needs to be kept in a steady temperature because otherwise adrenaline will degrade and will cause it to be rendered ineffective. So you need to carry it in an insulated bag to preserve it as best as possible. And that is why me and a friend of mine created Allerpack, which is insulated bags dedicated for that. So if you have children having adrenaline pens, being EpiPen, Jext, Emerade, you name it, consider using something like that. Oh, obrigada. De nada.
I'm just
Sempre
going
ao
to see if
dispor.
I can actually tag Allerpack. Oh, I can't. Sorry. Go ahead. I was just trying
We
to
can do it
tag
afterwards.
Allerpack, but
Okay.
I don't think I can make it work.
You're very welcome, Nishti.
Yeah,
I'll see you
yeah.
soon. Bye
Thank
bye.
you so much. Speak soon. Bye. Bye, everyone. Thanks for joining.